Hello everyone, I'm Naveen Agarwal and I want to welcome all of you to my weekly video update. Now lately I've been thinking about how we do risk analysis in our medical device industry. We use tools like FMEAs or failure mode effect analysis or fault tree analysis FTA very routinely. So this question came to my mind. What's a failure and what's a fault? Are they the same? Is there a difference between the two? Because terminology is one thing for sure. We need to be very careful about terminology. But the concepts behind those terminology is very important for us to understand at a deeper level so we can use them effectively in our work. So I reached out to my colleagues on LinkedIn and I started this conversation. And it was a very good conversation with a lot of people from many different industries. They shared their insights and perspectives and also provided some references to resources to learn more. And that's the power of LinkedIn and collaboration, which is what I love. And this allows us to collectively improve our understanding. Because you see, whether it is automotive or space or defense or let's say medical devices, any industry you pick, our end goal is still the same: to deliver beneficial functionality to our customers while keeping them safe, right? We are all trying to accomplish the same goal. We do it differently. So by learning from people from different industries how these concepts are applied in practice, we can benefit for our industry as well. That's the intent. So this video is not going to be a how-to video. This video is going to be more of a conceptual video and more for the purpose of discussion and understanding. So what I would like you to do is invite you to look at this the way I understood some of these concepts by reading through different resources and my own experience. But more importantly, continue to share your insights and perspectives on this topic. So collectively, we can enhance our understanding. That is the intent. So this is not going to be a how-to video, but more of a conceptual video. So let's look into this. First, I'm going to share with you two very good resources that, in my opinion, are excellent resources on this topic. The first one is the Fault Tree Handbook with Aerospace Applications from NASA. This is the definitive guide and handbook for fault tree analysis. The second one I came across through a reference provided by a colleague on LinkedIn as part of this discussion, which is great because I was not aware of this. This is Basic Concepts and Taxonomy of Dependable and Secure Computing, an article written in 2004 in the IEEE magazine. Excellent piece of work from the world of software development in the context of dependability and security. As you know, today this is a very hot topic. Cybersecurity and security is a primary concern and an emerging concern for medical devices as well. So the fact that a lot of the work has been done early on is a good resource for us. So these are the two good resources. I will provide a link to these references as part of this video. Okay, so let's look at a real world scenario. What are we talking about? This was a safety alert recently issued by the FDA. Risk of false negative results with SARS-CoV-2 RT-PCR tests. This is a common concern these days. Question is this a failure? Okay, so what are they saying? The US Food and Drug Administration is alerting patients and healthcare providers of the risk of false results, particularly false negative results. If you have a false negative, you actually have COVID and you don't receive the therapy, you don't isolate yourself, and it really is a problem for public health and also your individual health as well. So this is a big issue. So to reduce the risk of false negative results, it is important to perform the test in accordance with its authorization and as described in the authorized labeling. They are talking about that in the safety alert. So this gives us a clue about interaction between the test, the patient, and how the test is performed. But it is a problem, right? We're going to talk about that. But is it a failure or a fault? How do we go about understanding this? Well, let's look at another example. This is an ankle replacement implant, STAR ankle. And again, this comes from a safety communication from the FDA. Based on the results of the long-term post-approval study, the plastic component, it has three components. The plastic one is in the middle. That is the mobile bearing component. That component fractured at a cumulative rate of about 14% at 8-year post-implantation, with all fractures requiring additional surgery. This higher fracture rate and earlier than expected occurrence are concerning when compared with other comparable total ankle replacement devices. So they are comparing it against an expected performance level, and they are finding that it's not performing as well. So is it a failure or is it a fault? So we want to kind of continue to think about the terms failure and fault, or the concepts failure and fault, in the context of examples like this. This happens all the time. Okay, so fault or a failure. Failure is defined as an event where the output of an entity deviates from the expected and or specified requirement. So entity could be anything. It could be that medical device we talked about, the test we talked about. It could be a subsystem of that test. It could be a component of that test or component of that medical device. But when it fails to achieve its expected or specified requirements. Now those two are key words. So in case of the ankle replacement device, we don't know what the specification is. But the expected performance is not achieved in this particular case. So it would be termed a failure. It is detected, so a fracture occurs, and it's not meeting our expected level of performance. In some cases, when that happens, either the specification is insufficient or there is some other concern that the regulators or other people might have. Their expectations are not being met. So in that case, that is a failure. What's a fault? Fault is an event where an entity is in abnormal state, which may lead to a failure, but not always. This is where it gets a little bit confusing. So fault is being applied more generically. It's more of a generic term. Something is not normal. So what is normal? Right? Normal is sometimes defined by specifications or the level of expected performance. So you would say, if it's not normal, is it meeting the performance or not? That's where it comes into play. Specifically in software development, a fault is often considered a cause of an error. What's an error? In those terms, error is actually the deviation from the specification or the expected performance. So if there is deviation, that's an error, and a fault is often considered a cause of an error. This is very different from how we might do a failure mode effect analysis for medical devices. There may be more than one faults in a chain of error progression before ending into a failure. So this concept is also very important to understand, is that failure doesn't happen out of the blue. It happens because of progression of error over time through a series of faults. That's a very important concept to understand. Okay, medical device does not operate in isolation. We focus so much on the device itself during development that we forget that it is not operating in isolation. So you have the device, you might for convenience subdivide that into a system, subsystem, or its components. You might subdivide that for convenience and efficiency, and you might do your FMEAs at a hierarchical level, at the device level. But it is interacting with the professional, for example, the doctor and the staff, right? There is communication back and forth, use back and forth, expectations back and forth. So there is an interface, a boundary between the two. Well, there is also the patient. So the professional is interfacing with the patient and the device is interfacing with the patient, right? On the other hand, there is development, production, installation, maintenance, service, all those operations, they're also interfacing with the device itself. So the device is operating in what we call its environment. This is important to understand. There is so much going on in this environment that defining that boundary for analysis becomes very important. And it is within that boundary, whether something is internal or external, will allow us to understand properly if something is a fault or if it has really gone forward into a failure. Okay, so failure is usually detected at the interface, right? Something has to appear externally for it to be recognized as a failure. So in the case of the false COVID-19 result, it's not immediately obvious because the test is giving us a negative result. And if the patient is asymptomatic, we don't know for sure if it is a false negative or a true negative. Well, we rely on the test and we expect it to be correct. Not always the case. Doctor may still order a second test, right? In most of the emergency use authorization letters for tests, it is written a negative may be presumed negative, and given the history of the patient's contacts, another test may be ordered. Or the patient may develop symptoms, then receive a second test. So we will not recognize this failure until something happens. And that's the boundary I'm talking about. Same thing for the fracture of the ankle replacement. Patient experiences pain, loss of mobility. That's kind of a sign that something is wrong after implantation, maybe a few years after implantation. Doctor may suspect fracture, especially if there is communication and alerts like from the FDA. They may do some more tests, more imaging. They may do additional surgery and then identify. Now, that's how we will detect. But how did it get to that point? Sequence of events also happen before that fracture happens. And that is happening within the boundary of our analysis, right? So we have to look at the interactions of the device with the professional, the patient, and these operations that are supporting our device. I talked about development, I talked about production, I talked about maintenance, service, installation, if it is appropriate. We have to consider all of that in our analysis to be able to fully understand this chain of events. That's what fault tree analysis allows us to do. It allows us to build a sequence of events. Not all failure modes or not all causes of failures, but those we think are immediately linked to what we might call the top event. Usually the failure of the system as a whole is considered to be the top event. Anything that links to the top, and it's through our understanding of how they interact across this boundary that we can build that chain. Okay, so here is a schematic from the IEEE paper, and I found this pretty illuminating, that there may be a fault in your system, its underlying components, by design or by some other operation, but it may be in what they call a dormant state. So going back to the ankle replacement, maybe the surgeon did not align the implant correctly at implantation. That is a resident fault. And over time, it'll deteriorate into something more. So it'll progress and maybe subject the mobile bearing component to more stresses than it was designed for. Or maybe something happened in the design that perhaps induced more oxidation or more degradation of the part before it was implanted. So those considerations can lead to, or those situations can lead to this scenario, what we call a dormant or a latent fault. Something could trigger it, either an external event or an internal event. And that leads to a cascade of error progression. Error is a term utilized in the software industry, but for our medical purposes, similar situation could happen. And it is at the interface, the boundary of, in this case, component A to component B, when this error is now realized as a failure in the ability of component A to serve component B. That's the service failure. That gets propagated through component B now, same way. And eventually it bubbles up to the top. So as an aside, you guys might be familiar with the Swiss cheese model, right? This is, again, conceptual framework used very routinely in many industries. There are holes, and through that holes, and these holes are latent failures. Some are deliberate, some are accidental. And it is that trajectory of error progression through those holes that leads into a failure or a loss. So that connectivity is very important for us to understand. So the concept of active versus dormant fault is very important. Now the fault may remain internal or it may appear at the boundary, and it may cause a failure at the boundary. Lot of details, lot of nuances, and that's where I would like us to start thinking about, and I want to bring this to you from this video. This was huge. Again, a schematic from the IEEE paper. Conceptually, it is very comprehensive. These are the many different sources of faults that can come into our system. I just wanted to show you, not intending to go deep into it. You can look up the paper, but you can see there are over 30 different types of faults. Some of them are developmental faults. What they call physical faults here are pertaining to hardware because they are thinking about software here. And the interaction fault are across the interface. So we talk about human factors engineering a lot, right? It's all about interface, the interaction. And we have to pay even more attention to that interaction because through that interaction, many faults could be introduced in our system that may remain dormant and may show up later on. So yes, it is very rich in concept, can get very complex very quickly. And that is the intent behind this video, is to spark a conversation. I would like to know if you are looking at your system from all these different viewpoints. What are some of your best practices? What are some of the challenges that you face? Do you get confused in the terminology, failure versus fault? Does it matter? Does it matter if we characterize a fault in an analysis incorrectly as a failure? So I would like to hear more from you. As I said, this is not an end-all or a complete picture. It is just a starting point for our conversation. So I hope you will find this useful and continue to engage with me on LinkedIn or through your comments on this video. I would really love to hear from you. I hope you all are staying safe in these very difficult circumstances, and I look forward to hearing from you.